Hi, good evening to you. It's a wet Tuesday here in Guyana. Before we even start the show, we myself and Dr. Saw, we always advocate for safe driving. So it's rainy, it's wet, there's a lot of water. I just came over the bridge. Please be careful. Drive if you usually drive at 60, do 30 in this weather. We've had too many accidents recently, and this weather is not going to make it easier. But thank you so much for joining us from wherever you're joining us from. It's a small world when it comes to social media. I know lots of our viewers are from the diaspora. So you guys got some cold weather going on there. It's very cold. So we got rain and you got
Snow.
winter weather. All right. So Dr. Saw, this show is I love the comments. People are really giving us valuable and very good feedback on the show, that this is fastly becoming one of their favorite shows. I think that it's for the last few months that we've been here, we have really done something, and I think that we should really be thankful to our viewers. They have made this possible for us. So guys, thank you again. I know we got some really good viewers that always locked in here. So tonight we're talking about arthritis, but from last week we were talking about back pain. And while we're talking about arthritis tonight, I want to know what is the linkage, if there is a linkage between arthritis and lower back pain. But I know when you told me we are going to do this topic in arthritis, usually I would go and do my research, and there are a number of types of arthritis I got to understand. So there are three of them that I would like to learn a little bit more about tonight that I would want to ask you. Of course, our viewers are going to be sending in their questions. So if you guys know, if the pain has hit you every now and then in the joints and so on, tonight is the night to send in those questions, for doctor diagnose online, of course, what type of arthritis you may have, or if it's not arthritis, and you should not be worried. So, Doc, lower back pain. Last week we were talking, and I think we were just at the point where we can alleviate pains and so on. Different types of treatment, whether it's physiotherapy, what is required.
Oh, lovely. So I just need to clarify. Your question was back pain and arthritis and the link.
Yes.
So I try to explain, and I couldn't do justice on one episode to talk about arthritis, and I felt that I should continue as a follow-up from last week.
Yeah.
And let me explain. I said pains in the back generally can come from different structures in the back. So I show you that diagram where you have the spine, you have the muscles, you have the nerve. I think we dwell a lot on the nerve, that is trapped nerve from a disc prolapse. So we didn't get deep into the arthritis as such. Mm-hmm. So, however, your question is the link between back pain and arthritis.
Right.
So arthritis is one of the causes of back pain. So you have back pain for various causes. Mm-hmm. You can have back pain because the muscle is sore. That is not arthritis. That is just spasm of the muscle.
Right.
You can have arthritis because the disc is bulging. That, again, is not arthritis. That is bulging disc. You've got arthritis from irritation of the nerve. Pains from irritation of the nerve. But when it comes to arthritis, it is inflammation of the joint. That is by definition.
Okay.
So arthritis is inflammation of the joint. So a joint has to be part of it when we talk about arthritis. Now, of course, the back, we see the back as your spine, and it's got joints there. You have intervertebral discs in between.
Yes.
You have what we call facet joints. That is, the ends of the bone at the sides and at the back. So that is all. They can be arthritic changes there that will give rise to arthritis. But let us focus. So we talk about the nerve, trapped nerve, a lot last week. So I don't need to. I mean, we recap that. Shall we do a quick recap?
You can. I like the fact that you showed that diagram of that bulging that bulge there, because it's graphic like those that really makes you understand of literally the gravity of what you're dealing with, right?
Yeah. So. Robbie, if it is possible, maybe we can just recap that spine, the part of the spine. Lovely. So we dwell a lot on the nerve being pinched by the disc, prolapse disc. And I showed you when you squeeze the disc there, you get a bulge and it causes a nerve. So when we look at arthritis now, we're looking at the joint in the vertebra. Now, however, that the most common cause I say for back pain is what we call mechanical back pain, and that is general wear and
Wear and
tear.
tear, yeah,
Correct.
yeah.
Now there's a special type of arthritis that is linked to the back,
Okay.
and we call it spondyloarthropathy.
Okay.
And it is usually not from the spine, as in the nerve. It is from what we call the sacroiliac joint.
Right.
So on at the back where your sacrum is, that is just by your above your gluteus. You have a joint there, and that is called a sacroiliac joint. And most people, you can get pain from there with associated pains in your other joints. And that is a special type of arthritis we call spondyloarthropathy. Now, I want to show the classification. So we know what is arthritis now.
Right.
Inflammation
Exactly.
of the
Yeah,
joint.
yeah.
I just want to because lots of people, they think doctors tell them, oh, you've got arthritis, and patients come and tell me, I've got arthritis. I said, what type of arthritis you've got? They don't know. So I really want to, put this across for people to understand arthritis a bit more. So they should not think that all arthritis are the same. There are different types of arthritis. So if we just put that slide with the classification, the different types of arthritis, and then I will go down to each one and break it up. Correct. So if you look at this here, we'll spend a couple of minutes just for patients to understand this. I mean, this is a busy slide, and it looks at different types of arthritis. But importantly, so when we talk about arthritis, it's not just wear and tear of the back, or which is osteoarthritis, or any joint as a matter. It can be different types. So we want to break it down first. So you have arthritis right up, and then they're divided into two big categories. So you have inflammatory arthritis and non-inflammatory arthritis.
Yes.
And by definition, inflammation means pain, swelling, redness, heat, and loss of function. Those are the cardinal signs of inflammation. So you would have inflammatory arthritis where the joint is swollen and it is painful and you get restricted movement and it's red. Now you can't miss that. Now that is further divided. So first we talk about inflammation, non-inflammatory, and then the inflammatory type is further divided. If you look at that now, that is then divided into what we call seropositive. So that's your rheumatoid type of arthritis where there is arthritis of the joint with some inflammation in the body. Mm-hmm. So we do the blood test and you see it's all inflamed. There are signs of inflammation in the body with your inflamed joint. So that is called seropositive arthritis. And then you have a few of them there. Just be under that.
Right.
And then you have seronegative where the blood tests for the rheumatoid factor, we call it, is the arthritis, inflammation, inflammatory markers, and autoimmune tests to check the immune status of the patient. We call it seronegative. So the test is usually negative. And that type of arthritis is divided into 4 big types. You have ankylosing spondylitis. Now, that is a back pain.
Right.
So in the seronegative, the one that I call seronegative arthropathy, spondyloarthropathy, I said that the back pain, arthritis is one of the causes of back pain. And the category of arthritis, they're called spondyloarthropathy, and they're divided into those 4. The seronegative type. They are called ankylosing spondylitis, reactive arthritis, psoriatic arthritis, inflammatory bowel disease related arthritis. So I'll come back to that. So they're usually related to the back as well. So you get back pain, plus you have features. Each one I will go through and tell you in a minute.
Right.
But also in inflammation, you can also have infection. And it's very, very important. If somebody comes with an inflamed joint, so we know the signs of inflammation. You see the joint is red, it's hot, it's swollen. You want to make sure by all means that this is not an infection.
Right.
Because infection can destroy the joint. And if infection gets into the joint, it can get into the blood and you can have sepsis. So it is very important and it's very destructive to joint. So you want to pick up infection of a joint quickly. You want to treat it adequately. Let
me ask you this: in psoriatic arthritis, is it possible for another infection from some other part of the body to go to that to go to that area and cause an infection too?
Yeah. So psoriasis is a skin condition,
right?
Where you have a skin rash, sort of,
yes.
right? So you're asking if an infection, you can get infection from somewhere else.
Yeah, psoriatic arthritis can be brought on by another type of viral infection or so.
Yeah, not psoriatic arthritis. We wouldn't call it psoriatic, but a viral infection can cause a different type of arthritis.
Oh, okay.
And so psoriasis by itself is that skin condition which is associated with arthritis. Okay. And the condition generally is where there is a genetic component to it and an immunologic component. That is, your body react to certain factors, agents in your body mount an immune response. And then so we talk about infection, and then you have what we call crystal-induced arthritis, and that is your gout, classically your gout and what we call pseudo-gout. And then so these are your inflammatory arthritis. And now you have what we call non-inflammatory, and that's your wear and tear.
Right.
Osteoarthritis. By and large, that's the most common type of arthritis. So if we look at it, just for the viewers to focus a little on that, the majority of cases of arthritis is osteoarthritis, which is in the extreme right there, I said. And it's a non-inflammatory arthritis, so it's not usually, there's no swelling necessarily of the joint. Of course, you can get some osteoarthritis, and if you overuse the joint, it gets inflamed. But classically, that is not your inflammatory arthritis. That's your wear and tear or mechanical type of arthritis. All right, so Robbie, we can move from that. That's okay.
Right.
We'll come down to the treatment and those different types. So when we talk about seropositive, that's your rheumatoid arthritis. So rheumatoid arthritis, inflammation is classic. So what causes rheumatoid arthritis? It's an autoimmune condition where the body reacts to something. And there are different, we don't know exactly the agent as such. It can be various agents. It can be induced by viruses, by different mechanism, but it's an immune response. And then you have a genetic predisposition. So they have identified different genetic factors that can lead to rheumatoid arthritis. Then of course that's your classic seropositive one. How do you know what type of arthritis it is? Is the features, the presentation. So first, you got to tell yourself, so if somebody comes in with joint pain, you want to ask yourself, do I have inflammation or no inflammation? If I have inflammation, is it an infection? Well, you said, fine, I don't have fever, and it doesn't look like an infection. Is it gout? Because gout causes inflammation as well. But each one, I'll tell you, how do we identify gout? How do we identify an infection? And then the back pain associated arthritis. The ankylosing spondylitis, that's the one where you get sacroiliitis, that is back pain, and you get, over time, sometimes you have fusion of the spine.
Right.
And you can also have other conditions. Ankylosing spondylitis can give rise to other, what we call extra-articular manifestation. Heart conditions, it can affect your lungs, and things like that.
All of that?
All of that, yes.
Wow.
You can get what we call fibrosis of the lung, in that type of condition. So it's not only the joint affected, but it can affect other parts of the body. The reactive arthritis, so there are some types of arthritis where after having a diarrhea or a urinary type of infection, your body mounts an immune response, and we call that a reactive arthritis.
Right.
So we bring all of that into the group called spondyloarthropathy. So there are classically four types. The ankylosing spondylitis, where you have pains in the back, and to diagnose that, you will do an X-ray or an MRI. But the thing about it is sometimes you don't see any changes early. It comes on late. Patients will come with back pain, and that is sometimes confusing. They are diagnosed with mechanical back pain, as in wear and tear. However, it is a beginning of a more serious type of arthritis.
Wow.
So we can't be dismissive of a back pain and say, fine, this is purely wear and tear. You can have, ankylosing spondylitis or any of the different types of arthritis. The psoriatic arthritis, most times you will know it. You have psoriasis, or you may have the arthritis before the psoriasis or after. And then you have something called, in the nails, you will see pitting of the nails. So when you look at a nail, as if somebody it's got pits.
Right. Yes,
puncture them. Inflammatory bowel disease type of arthritis, these are the patients with Crohn's, ulcerative colitis, they have some bowel disorder. and you get associated arthritis with that.
Wonderful.
Right.
Doc, you talking about arthritis and the linkage to back pain, and my back hurting by just listening to this, because I have, that I would have come and had an examination done by you. So now, as you rightly said, there's no cure for this.
Sure.
So what I'm doing, I'm trying to manage it. I'm trying to, do the best I can, and doing some exercise and take it a little bit more serious than I was before.
Yeah.
Because what can happen, as I realize, is that if you don't take this in hand, in a shorter span of time, it's going to take hold of you.
Well, importantly, I mean, if you pick up a condition early, I mean, any disease condition or process, if you pick it up early and you know what to do to prolong the progression, so you don't want it, you want to delay the progression, that is. So you don't want the condition to get worse fast. You want to go as long as you can in comfort, right? So if you know I've got wear and tear arthritis, then I would try to do things not to damage the joint. I would try to do certain exercises and be careful with your back, because those things can trigger, certain exercise can trigger more pains. And even high impacted, like jumping.
Right, exactly. I was just going to mention that, because what contributed to my back pain, and I know this for a fact, is that I used to play a lot of table cricket, and you play ball cricket, you're playing on hard surface, concrete.
Right. Yes.
And I used to run in, I used to think I'm the next show back there. I wanted to bowl fast. So that impact, that transfer of weight and the momentum they go with, it transfers through your joints into your back and all that. And that's where it actually started. So had I known that I needed to I couldn't afford to get anything better than what I was wearing anyway.
Sure, yeah,
but equipment,
you would have taken precautions.
Right. Using the right equipment, especially in high impact sports, is very, very necessary.
Yeah. No, absolutely. I mean,
even in workout at home.
Well, yeah, even going on the treadmill and running and jogging and all of these things, you should have cushion in your footwear, that is the right footwear, to reduce the impact on your joints. And it includes your back and your knee and your hip. Now, when we talk about the common, like the treatment generally, so when you have osteoarthritis, those treatment usually would be your painkillers and then joint replacement. So we'd replace the knee and we'd replace the hip. So most people who have got joint replacement done, they get what we call osteoarthritis. That is wear and tear arthritis. And we all will get arthritis, without a doubt. So when somebody, as you get older, you get wear and tear. So you will all of us will end up with what we call osteoarthritis over time. But the type of arthritis that is not so common is the inflammatory arthritis. I mean, more and more we are seeing, for some strange reason, I am seeing more and more of these inflammatory type of arthritis. And, our immune system, there are loads of theories where our gut microbe, we talk about that sometime in the past.
Yes, that's right, yeah.
They are mediators of your immune system, and the whole, the way the cause generally, and what we call the pathogenesis, that is how the body reacts to certain things and respond to things. It can all be governed by the gut microbe. So all these factors, they play a role in the cause as such. Okay. And of course, you get a genetic susceptibility or genetic predisposition.
Look, one of the questions that came in here just now has to do with, it's a simple thing. I've heard, and I don't know whether it's a myth, but I've heard since I was growing up, don't crack your fingers because you're going to bring on arthritis on yourself. You've heard this, right?
I've heard that, yeah. But
somebody said it in the somebody said it here that the doctor was doing an assessment to me when I stressed my feet, my bones crack, and he told me I would have arthritis in that joint.
So when we test for that type of arthritis, that is called crepitus. So when you move your knee or your joint, you feel as if something is moving and grating, and you feel that noise. So that's called crepitus. You can feel and hear that.
It's not a smooth motion.
Correct. But when you crack, generally, you put in trauma. So that can cause arthritis. It can lead to wear and tear type of arthritis, but not your inflammatory arthritis. It will cause a traumatic type of arthritis, over cracking. But cracking a couple of times, not going to do that. I'm talking people who's doing it like regularly all the time. Yeah.
Some people are addicted to cracking their fingers. Another question here is, some people with arthritis swear that nightshade vegetables, such as tomatoes, potatoes, eggplants, peppers, cause their arthritis to flare. While there are many studies to support the link between arthritis and pain, most nightshades, tomatoes might be an exception. That's because they have raise the levels of uric acid.
Yeah. Well, there's a special type of, so I mean, generally, for wear and tear arthritis, it's not food related. That's a mechanical thing. The pathology behind inflammatory arthritis is again genetic susceptibility and immune modulation, right? The role of food generally, I can't identify any particular food except for gout arthritis.
Right.
So that's a different type of arthritis.
Yeah, the red meats and so on.
So so gout now, in the type of inflammatory arthritis, I had on that slide, you have what we call crystal arthropathy, and gout is one of that. So gout is usually characterized by the big toe generally. The joint in the big toe is is generally affected, but of course any joint can be affected.
Okay.
But that's a common joint to be affected. And
why though? Why?
Good question.
Because most people that I know seems to talk about gout. It's always localized to that toe area.
Exactly.
Yeah.
I mean, I don't know. To be honest, I can't. But I think there is something in the past I read. It's to do with the blood flow and the temperature can induce something to do with that.
All right.
But I can't say. Honestly, I mean, I haven't
That's
really
very,
looked at
it's very strange that this one type
as
of
to
arthritis.
why that joint. Now, maybe I have to go and research as to why that joint. But that is classically. They say 50% of patients will present with gout, would have that big toe involved, and it can go up to 90% over time. So majority of patients would have that. But you can get it also in your instep, in your ankle, in your knee, in your hands. So gout can be anywhere. Coming back to the food.
Right.
Now, purine food increases uric acid. And that's the type of food, the purine in the food, we need to reduce that. And you get that in like sardine, oily fish. Of course, we know oily fish is good for you, but too much also can cause gout. Red meat, organ meat. So liver, kidney, beer, alcohol. And the triggers generally, eating high red meat, dehydration. Certain tablets can cause gout as well. Diuretics, water tablet that you use, they can increase your uric acid level. And of course, again, uric acid and gout, there is a genetic component to that, so it runs in family. But I mean, gout is a very common thing, and they used to call it a rich man's disease. Meaning the guys that were drinking and red meat and all these organ meat, it used to call it rich man's disease. But just to spend some time on gout, I mean, because gout is common, how do we manage it? And there are two ways of managing gout. And I try to explain this, to patients all the time, because sometimes it's confusing. So your uric acid is high in the blood, and not everyone with high uric acid will get gout. So if the uric acid is high and you have presentation of gout, two things we want to do. We want to first treat the acute attack. So when you have an attack of the gout, we want to treat that, and there's special medication for that. So I'll come to that. And then you want to prevent you from getting gout again, because every time you have an inflammation and a gout attack, you're destroying the joint. So if I want to preserve the joint, I want to prevent you from getting gout, so I want to lower your uric acid. And there's a special drug that's called, have you heard of allopurinol?
No.
No, okay. So that's a drug we give to patients to lower the uric acid. So there are, two ways of managing. It's not just treating the acute attack. And the acute attack, we treat it commonly with anti-inflammatory. We can treat it with a drug called colchicine. We can treat it with steroids as well, so prednisolone. But generally, your anti-inflammatory, like your indomethacin or your naproxen or your ibuprofen, that's your NSAID, non-steroidal anti-inflammatory, or colchicine.
In areas of arthritis that see, some people become basically paralyzed because of this. Does stem cell fit into any of this here, Doc, in recent medical advancement?
Yes, I would think so, because it's an inflammatory process in the body. And now the drugs that are used a lot in arthritis, in the inflammatory arthritis. So
Yes.
this is not your mechanical or your common wear and tear
yeah, yeah.
arthritis. In inflammatory arthritis, there's a role for that. There are a new set of agents, well, been around for a little while, but they're called biologics,
Okay.
where they work on the immune system. So the similar type of, stem cell will have a place there, but I am not an expert in that area. What I would ask my rheumatology colleague, they would tend to manage most of these complicated inflammatory type of arthritis.
I'm asking this because my I want to know the future of my back pain. We have a caller. Let me take this call. Good evening, caller. You're live on here.
Hi, good evening. Doc.
Hello. Good evening.
Hi. I'm glad Akash raised the point about arthritis there, because my wife is suffering osteoarthritis, which means that the knee has collapsed.
Yes.
Totally collapsed.
Yes.
She had a knee replacement on one of the legs.
Sure. Yeah.
And the other one unfortunately collapsed too. But I have cases where the second leads to death.
Sorry, repeat that. What you just said?
I said I have known of situations where the second operation of the leg, of the knee, leads to an unfortunate death. Now, it could be just a coincidence, but
yeah, I mean, I would think more. Yeah, I mean, you can have complication from any surgery. I mean, you go on anesthetic and you're having a big surgery, and a knee replacement is a big surgery. There is no direct link that if you've got one done and doing a second one will generally cause that to happen. So that's a coincidence, really. That is not due because you've had a second one done. Yes, I would say generally most people, when you have joint replacement, because remember you have your body weight is symmetrical, you would get one knee affected, both knees would be affected, both hips would be affected. But because we are, we sometimes tend to put more pressure on one side than the other, our posture, the way we fetch load, sometimes you get one going force. So one side is more severe than the other. And classically, that tend to happen, that you get one surgery and then at a later date, they will schedule your next surgery. But if she has benefited from the force, where her pains and her movements and everything, if they've all improved, I think, you shouldn't worry too much. And doing the second one, I mean, if you have confidence.
The reason I'm mentioning this is I think it might be more of a psychological thing affecting me. I have an aunt who did that, and when she did the second one, she collapsed on the operation table and died.
And was that shortly after? Like how long after?
Nah, like a few years after.
Because, right, so what tends to happen, remember, our condition, as I say, it's a big surgery, right? And anesthetic, you can have complication from anesthetic. And as time goes by, the risks, as you get older, that by itself is a risk. So you got to know that, okay, maybe the first surgery, she didn't have all these complications. And the second surgery, she's got more complications.
Well, it's all a person the second surgery, and organs gonna start giving up.
Yeah. That's what I mean. Yeah, of course. So
another thing though, I would have been a victim of I fell from a ladder changing a light bulb, and I dislocated my left shoulder.
Yeah. So usually, go ahead.
And it was popped in back by someone who assisted me after I fell off.
Yeah.
But to date, I am still suffering massively.
Yeah. So usually,
is it a case will never be healed?
Well, I wouldn't say it would never be healed, because what tends to happen, the shoulder joint is a ball and socket joint, right? So when you slip that out, you can get arthritis from the trauma. So the arthritis has to do with the two bones touching each other, and that's the joint, the arthritis. But majority of times, shoulder pain is due to the ligament and the muscles that hold the shoulder up.
Right.
So the shoulder joint is not a weight-bearing joint, generally. It's a ball and socket. And most of the pain that you get from it is ligament type of pain. to get arthritis in the shoulder, that is that big bone, that's a late, you get as you get older, and a trauma can do that. But what you're saying to me, I think if you're still getting ongoing pain, it's probably more to do with the ligament and the muscles and tendon and some impingement probably causing it. I wouldn't think that it can lead to arthritis, osteoarthritis over time.
The pain has reduced a lot recently, if I have to be honest about it.
Yeah.
And I've been trying to do exercise on the left arm, which is the one that was dislocated. Sorry.
Yeah. Well, physiotherapy and exercise is a way forward, without a doubt. Yeah.
Well, let me ask you this though. You live in the diaspora. It's I think it's about 9 degrees centigrade, something like that there today.
The weather.
Yeah, the weather, right? So it's cold. How does the cold weather affect you and your wife also?
To be honest, I am being less affected recently.
Okay.
Yeah.
Because I was trying my best to do exercises and put hot patches and stuff like that on the arm that was affecting me, and in all honesty, the pain has reduced tremendously.
Well, over time, your body will heal itself as well, right? So if the ligament or you have those type of problem, with time and the exercises that you will do, you'll strengthen the muscles and the ligament. So, we would expect that to get better. But a type of arthritis that people get where you have wear and tear, it usually is a progressive condition that gets worse with time. So the good news is, I think the fact that you're getting better, it tells me that nothing permanently is damaged. And, it's just that you had some laxity there that caused the dislocation. So continue to exercise and do the right, do that.
Thank you very much, Doc. Once again, guys, I'm really admiring this program and I'm enjoying every bit of it.
Thank you so much.
Thank you so much.
Take care.
All right.
Bye.
Yeah. It's good to hear people's experience, because you always hear that during cold weather, people usually say, look, I know a ring of fall.
Yeah.
I know a ring of fall. I ring of fall do this because this arthritis is flaring.
No, well, that is true,
Yeah.
because the cold causes vasoconstriction, we call it, right?
Right.
So the blood flow.
So the temperature, atmospheric temperature changes. That's
of course,
what happens.
and that's why patients with arthritis will get more pain during the cold weather. I mean, of course, most people, if you're indoor, you get your heating on, probably it helps. I mean, none of it probably, but I know it will help. But generally, if you're out in the cold, your joints hurt more. And the patients with inflammatory arthritis, they'll tell you they get morning stiffness. Classically, even most of the arthritis, the joint is stiffer in the morning and more painful in the morning. And as the day progresses and you start using it and you have more blood flow going to the joints, you get less pain.
Right. Arthritis sometimes you hear that very young people, you hear kids
with arthritis,
yes,
definitely. So, I mean, you heard of rheumatic fever,
right?
Rheumatic fever, you get that. I mean, lots of children get, generally, it can happen to anybody, but you would have arthritis with rheumatic fever as well. Rheumatoid arthritis, you have juvenile rheumatoid arthritis, and that's the inflammation of the joint in children. There are some children with viral infection, they can have a type of arthritis after having a viral infection. So you have different types of arthritis, and it can affect young and old, I wouldn't expect children, however, to get osteoarthritis.
Right,
That's
right.
a degeneration over time, wear and tear.
Yeah.
They will have more of the inflammatory. Sorry.
When I hear that, when I heard about kids having arthritis, I was like, wow, that's just kind of strange.
Yeah.
But Doc, a little off topic right now. You see, I'm drinking this tea all the time. Robert just had a full back the cup because there's a little bit of a I don't know if it's a seasonal viral infection going on. People getting cough, some people getting diarrhea, vomiting, nausea, like symptoms of a cold. This morning I felt a little strange, so I'm drinking some tea and I may cough from time to time. I'm trying to control it, but to the viewers also, excuse me drinking tea all the time. It keeps my throat better. So arthritis, ain't nothing we could do about this. I mean, certain types of
Treatment,
arthritis.
of course. So we can come to treatment.
Treatment, that's right. So what is it? So tell me about.
So first we get a diagnosis now. So if you get pain in your joint, if you present with redness, swelling, and it's all inflamed, we'll say this is inflammatory arthritis. Treatment, we would normally start with. So the non-pharmacologic, I always talk about non-pharmacologic treatment first. So that would be, eat healthy, try to lose weight if you're overweight, because all those things put more pressure on the joint. Reduce your alcohol, cut down, stop smoking if you're smoking. That's your non-pharmacologic treatment. And of course, there's a place for things like acupuncture, chiropractor, those alternative types of treatment. Now, coming to the pain relief now, we talk about our normal ibuprofen type of family of drug. They're called NSAIDs. They are NSAIDs, non-steroidal anti-inflammatory. So that's for immediate pain. But we don't tend to give that. When you have inflammation where you have rheumatoid arthritis or that inflammatory arthritis, usually the nature of those conditions, you have what we call a remitting, relapsing type of condition, and progressively they get worse over time. We tend to give special drugs. They're called disease-modifying rheumatologic agents, right? And I don't know if you heard of, there's some, I'll just say some names so the viewers can, if they're on it or relatives are on it. There are drugs like methotrexate, sulfasalazine, hydroxychloroquine. These are all drugs that are used as disease-modifying drugs.
Right.
And the inflammatory type of arthritis, classically, it will present symmetrically. Your hands, so patients come and say, Doc, my fingers are swollen, both sides are swollen. These are these knuckle joints here and here. And morning stiffness, so they can't, squeeze their hand in the morning when they wake up. So and we want to pick it up early, because the longer you take to treat this condition, it can lead to permanent damage to the joint. And that's why you've seen some people walking deformed with their joint twisted. Normally, if the bone is eroded, because over time it damages, the joint itself, the bone gets eroded and the joint gets twisted.
You mentioned hydroxychloroquine. Is that a drug that came to prominence during the COVID?
Yes. During COVID time.
That's right. I remember that was on the top of the charts.
Correct. Yes.
Yeah.
So your management would be your painkillers to start with, so we want to manage your pain. And I'm talking here now inflammatory arthritis, classically rheumatoid, and then there's another type which gives you back pain with the arthritis. That's your spondyloarthropathy, and those are the ones we use the disease-modifying agent. And if it doesn't work, or your arthritis is progressive, we would then go to something called biologics.
Right. You did mention that earlier.
Yeah. So they are immune therapy.
Yeah.
They work on the immune system, and that's their management. And there's a role for steroids, prednisolone. Prednisolone.
Yes, of course.
Steroid,
Yeah.
So we'll give that short a burst of that you will give just to take away the inflammation initially.
Prednisolone is also used in lung infection?
Not infection, but lung inflammation.
Lung inflammation.
So I said certain types of arthritis can also lead to fibrosis of the lung.
Yes.
So some patients with arthritis, the lung loses its elasticity. So normally the lung stretches and recoil like that.
Yes.
And you can have some fibrosis happening in the lung as a result of arthritis. And they classify it interstitial lung disease, we call it. Interstitial lung disease. And even some patients need oxygen because of that.
You talk about smoking and it's linked to arthritis. It must have been about 20 years ago, I was watching the Oprah Winfrey show, and somebody spoke about something called Borges disease.
Yeah.
Right, where this smoking affects a specific spot in your foot. On your instep, right?
Yeah.
And that was like, so many people were suffering from this. So many people were suffering from this particular, little bit of rubbing and so on. It feels better.
Yeah, so it's a blood vessel get affected.
Right.
And smoking, as we know, damage what we call endothelial cells. Mm-hmm. So in Borges disease, that's what tend to happen. If you quit,
you can reverse these things, can you?
Well, I wouldn't think if you quit it to reverse, but it helps.
Okay.
I mean, most of the time is a combination of autoimmune processes happen. And smoking is an insult. So if I'm adding insult to injury,
Right.
it makes it worse.
Exactly.
So
exactly.
you want to, yeah.
Yeah.
So, no, but it's important. Anything that is causing you more, pains, discomfort, you want to avoid those things.
Let's talk about non-medical treatment such as yoga, physiotherapy, applying hot packs or cold or cold packs. Does these things help or just where does this have a place in managing arthritis?
I mean, it has a place for sure. So when you have so inflammation is your redness. So what tends to happen when you have an inflamed area? You get pain, you get swelling, you get redness. The blood flow increases, so your the blood vessel dilates, right? It expands. Now that causes more swelling. So that's why initially we put cold. So when you have an injury, for instance, and in the first day, we would advise put cold pack.
Right.
What the intention of that is to constrict the blood vessel so you have less inflammatory
Flowing out.
Right. And you'll get less swelling. And of course, it helps the pain as well. But with chronic arthritis, after the first day or two, you would then want to put heat. What heat does now, heat increases blood flow. Blood flow helps healing. If you have restricted blood flow, for you to heal something, you need, your components of the blood to promote healing. And if you increase the blood flow, now coming back to those pains and you're rubbing the heat, so lots of the gels that they give, they have anti-inflammatory drug in them, but also the whole mechanism of you creating heat. All these heat rubs, you're increasing blood flow, you're increasing healing. And it ties in with when you say the weather is cold and you get more pain.
Right.
So if I'm now massaging this area and rubbing it and create heat, it helps the pain. So there is a place for that.
Let's talk about two more aspects. Some people call it deep tissue massage, sports massage, all these different types of massages. Some people, they would do it for a few hours. They're gonna rub this area. They're gonna, some people tend to really put their hand into that thing and apply a lot of pressure. And some people also seek the help of not necessarily a chiropractor, but somebody who knows for crack.
Yeah.
Right? Somebody who knows to crack. You say, well, the man down the road there, Uncle so-and-so, he know for crack. Go there, he can start you out. Some people swear by it that when they go to these people and they get a crack, they feel better. What's going on there? Let's talk about massage first.
Okay. So I think massage has got its place there, right? So the massage, it's about getting the muscles, increasing blood flow to the muscles, create a soothing effect. So that is really, and also the muscle go into spasm. So when you have a back pain, you bend to lift something up.
Right.
You muscle go into spasm.
Yeah.
And massage will help that. Because you're massaging the muscle, you're relaxing the muscle, you increase blood flow, and you create a soothing effect. And any part of your body, right? So there's a massage will work for that. Now, when it comes to cracking, fair enough, I don't mind somebody crack my hand or my toes or something, but I'll be wary of someone cracking my neck or my back. Because also, I mean, if you're young and fine, there's no so much of wear and tear in your body. But as you get older and there's lots of wear and tear, you can injure the areas, you can injure your neck and injure the nerve. So I'm not a big fan of cracking, and I remember going to a massage and, we were on a holiday and, the masseuse said, I'm going to give you a crack. I said, no, relax, I don't want that.
You want me to last crack you here?
They want to crack my neck. I said, no, I'm not going to, nobody's going to crack my neck. But of course, it's got its place in trained hands. And I mean, I wouldn't, it's difficult for me to say as a conventional guy in medicine to say, yes, I would recommend. I think cracking has got its place, but in the right hand, yes, it will work. But I wouldn't be recommending that to elderly patients with severe osteoarthritis. It can cause injury as well. So you just got to be mindful of that.
All right. So now we come to the one more treatment that is available here in Guyana. There are a lot of herbal treatments here in Guyana. Some people got a leaf. There is a leaf that they call the pain leaf. They say if you take this leaf and you coil it on the stove and you wrap it on the joints and so on,
sure,
it eases the pain. What I believe happening there is when you coil it, obviously it's releasing some chemical composition out of the leaf that penetrates and probably act as a painkiller, natural painkiller or something like that. But are you taking in toxins too?
Possibly. I mean, topically, you can absorb things through the skin.
Yeah.
So I don't know what leaf is that, but yes, drugs can get into the body, into the blood system through topical application. So if you put something on the leaf and it gets absorbed into the skin, it can get into the blood system and it can take away as a pain relief. But also, you made a point there that I just want to highlight. When you have inflammation, swelling and fluid in this area, they put poultice as well.
Right, exactly, yes.
So what is a poultice?
Yeah, that's right. The same
so
thing.
The poultice is made up of what we call, it's got things in there that pulls the water out. So whenever you have a swelling or an inflammation, there is increased tissue fluid. So the poultice can act as a astringent to pull into it.
I thought they used to make poultice with Edo, boil the Edo.
Yes, correct. So it creates an osmotic potential, we call it, where it draws the inflammation in.
Please tell me what type of other poultice you know about. I know about they used to take the chewing gum and make a poultice with that to when children get hard boiled. They paste it on that. They said it helps to make that abscess.
And people put things like turmeric and all these anti-inflammatory properties they've got, for their painful joints. I've seen lots of patients come in and say, when I look at a joint, it's all yellow and it's turmeric all over their body.
Okay, right. And if you go to Border Market, Doc, and you go wrong there and you ask them, man, where you got for arthritis? I'm telling you, they got 10 different things, right? But they got a bottle with all kind of different things, like arthritis medicine, back pain medicine, and these kind of things. But I myself, look, in one's quest to be better, in one's quest to feel better, because you're thinking, man, like, what else can I do? So a lot of times what happens, people say, you know what, I'm gonna take the chance. I can take the chance and drink this thing.
I mean, yes, I'm not saying, like I told you in the past, that I'm not an expert on herbal stuff.
Yeah.
I would just be mindful to advise patient. Most of the drugs, they get metabolized by the liver and excreted by the kidney. So it has to move through the liver and the kidney. So if you're using anything herbal, always ensure first and foremost that your kidney and your liver function, they're good. Secondly, while you're using the herbal stuff, I would advise after a few weeks or months, have another test.
Right.
And compare and see
where you are.
So if you see that, okay, my liver enzymes are going up, then it may be due to something you're taking.
Right.
As I said, most of the herbal stuff, they get good and bad in them. So maybe the good thing is working, but we don't know what the bad thing is doing.
Right. And most of the times when you're boiling these leaves, now remember, the process of boiling this leaf is not, they're not extracting just the active ingredient is going to make you feel better.
Correct.
Everything, including 1,000 toxins that is in this leaf.
Yeah.
Somebody mentioned, is a noni tree?
I know noni, but
right. So that's the leaf that they use.
Yeah.
That's the leaf that they use as the pain leaf.
Oh, okay.
Right, they quail this leaf.
Yeah.
And they put it there. I'll tell you something, Doc. Sachin, who works at the studio here, a little off topic, but I'm going to tell you this. As a kid, when he would get a cold, there was a plant that I had in the yard called sweet aloes. I would put it on the star one and quail it and then squeeze the juice out, add some salt, and I kid you not, Doc. All the tossetryl and so on. One time he knocked on, he good to go. Now, I was probably naive at that point in time in my life to be given a child something that I haven't done any research on either. But I took the advice from the older people and say, you know what I have this by? So that is how information is basically spread. People who have ailments say, man, look, this thing bothering me bad, and say, man, look, you go down. I drank this thing, it helped. But of course, I share your sentiment that patients should approach even herbal treatments with caution.
Correct, yes. I mean, and most of the people who are trained to recommend those things, they should have an idea. If I'm prescribing a drug, I have to be confident enough that whatever I'm giving you this drug, I know the dosage, I know how it is metabolized in the body, I know what the side effects are, then I will give you the drug.
Right.
And likewise, so I would want that herbalist or, whoever is giving you whatever, they should give you some information about that. And then you have to bear in mind that you can have conflicting, you're taking two things where there's an interaction. So always be mindful of those factors. I mean, coming to rubbing your joints, if you have mechanical or osteoarthritis, which is wear and tear, massaging and rubbing and thing, it's good. But if you have inflammatory arthritis, rubbing that is going to create more problems. Remember, your joint is already swollen, it's red, it's hot. Why am I rubbing it?
But boss, doc, not no feel better than that. You know, when you foot hurting and you sit down and somebody can rub your foot for you, bro, that's like heaven.
I agree.
You know, so I'm not saying, I'm just saying that we tend to ignore what can happen just for the comfort.
Correct. No, soothing rubbing, as in lightly rubbing that is soothing and it's comforting. But what I'm saying that if you have a joint that is red and hot and inflamed,
it causes more damage.
And you go in and massage this thing, it's not the best thing to do.
It's true because you it's already bad. And by adding you're adding, as you rightly said, insult to injury, literally, because you're causing more injury by doing that.
Even people who've got sprain. I mean, it is not about going and rub the sprain. Yes, you can do some light soothing and whatever stuff, non-medical stuff you want to use, but it's more soothing and rest, elevation. That will help, and it heals with time.
I'll tell you something. You see, long time when you smile, you get a sprain or so, and my grandma is carried by some old man to rub.
Indeed.
To rub, bro. This thing was so painful, because this man just, I'm a little kid and he's not feeling the pain, but he's rubbing this thing, and then hey, we're really strong for survive those things. I mean, I'm telling you, now that you know better, right? Like me, I was giving Sachin this leaf. I mean, thank God that everything is fine and he's okay.
Yes.
But I swear by it too because it worked.
I mean, as I say, if I don't have the knowledge about something, I'll, ask someone who knows.
Right, but again.
But I can't,
Caution.
Caution, yeah. As a simple explanation, it has to go through the body system. It can affect your organ. You just make sure you have good kidney, good liver, and then you monitor that. And then if it's working and it's helping you, maybe, yes, go for it. Why not?
We have about 7 minutes more to go. Is there anything else that you want to talk about with arthritis that you have been seeing here in Guyana? You talk about back. A lot of people. Do you see a commonality when it comes to the lower back pain?
Yes.
And what other forms of arthritis you see the most common here in Guyana?
So most common lower back pain would be mechanical or wear and tear arthritis.
Right.
And
that's me.
Yeah, that's you.
Yeah.
And it happens in any joint,
right.
Knee joint, hip joint. And classically, those are the patients will get joint replacement done.
Right.
Like our caller that called in and said the wife had one knee done, we'll have the other one, you'll have a hip replacement done. But the back pain type of arthritis is a special type of arthritis.
It's really special.
As a joint is involved, a sacroiliac joint, we call that.
Right.
And an MRI or an X-ray will show that.
The wear and tear.
Yes. So you see that in that particular joint. And that is then associated with all the other types of arthritis in your fingers and hands and, your limbs. You can get back plus that. And then you have something called enthesis, where the ligament is attached to the bone and the muscle, it gets inflamed. So you can have, your pains in your buttocks, pains in all these sides of your body, where ligaments inserted into the bone. Correct. So that's the type of back pain that gives you, and that's usually there are rheumatologic conditions that a rheumatologist would, treat and manage. I'm
trying to make another linkage here now. Let's say someone like myself, I come into the studio in the morning at about 7. I'm sitting out there. I'm doing some work in the chair.
Sure.
Then if I got to go somewhere, I jump in the car, I drive, I go to that place, I come back, sit again. When I go home, I sit in front of the computer to work again. Most of the time, we're not very active. Does that what does being active
inactive,
mean or inactive does it really contribute to
of course it will, because remember your joint you're moving your joint. If you're not active and you're not using those muscles that you meant to use, and then suddenly you go to use it, you can cause injury. And that's why athletes, when you do sports, you'll do some warm up before that, and even athletes they do lots of exercises to train their body. You don't just go into something. So if I'm sitting on all day and my muscles are not being used, or I don't, lift something and I go and lift something heavy, I start to put strain on that muscle or that ligament that I'm not accustomed to generally. And it can snap. So patients have injury, ligament, Achilles tendon, shoulder, a common cause of shoulder pain. I mean, if you just lean backward to reach for something, you don't normally do that generally. You can pull a ligament.
Yeah.
And lots of time you actually tear the ligament.
Yes. Somebody in here had it one time when you first came, I remember.
Yes, and you get impingement. So the ligament get, it's stretched and it get caught in certain movements,
The conversation in the comments when I'm talking, I'm still monitoring that, seems to be on shock therapy, and people have various ideas on shock therapy and how they like
shock wave therapy is a type of therapy that we use, the physio will use. We treat tendonitis with that most of the time.
Okay.
Not necessarily the arthritis as such, because arthritis is very specific when it comes to, if it's an inflammatory arthritis, medication is probably the way forward, because I would always insist, we have a movement where we are trying to start people in medication early, at least within 3 months. You want them to be seen, diagnosed, treated, because you don't want to delay that. With the types of tendonitis and the tendons getting inflamed, if you're getting a lot of that, we call it enthesis, with back pain, then I would be looking at those types of spondyloarthritis, spondyloarthropathy I talked about with the back and your joints.
So the last thing I want to ask you about here, Doc, what's the mental approach someone should take towards arthritis?
I mean, that's a very good question, and I think it's important. So 2 things. If you know you have got a condition that there's no cure for, right?
Right.
You want to be mentally prepared to say, fine, whatever is happening to me, I should be equipped enough to endure it. And it calls for psychological preparation.
Yes.
So you have to be psychologically prepared, because let's say suddenly you can't perform the job you are doing. You can't do the sports you like to do.
That's right.
So there's a big psychological input in that. And then managing your pain by itself. There's a psychology in that. And so you accepting a condition that you've got, you can reset your pain threshold. Remember, all of us experience pain and we respond differently to it. And if you are with the intention that, okay, this thing is going to disappear, and you're not psychologically prepared that I'm in for the long haul, it can affect you badly. So there's it has a psychological impact on most patients.
Yeah, because your life changes right in front of your eyes,
But I don't want patients to feel that, thank God, most of the inflammatory type of arthritis, they are not very common. Most of the arthritis that we see would be the non-inflammatory, and it's the wear and tear over time. So if you're diagnosed with arthritis, just to recap, you want to find out, is this an inflammatory type of arthritis, or is this wear and tear arthritis? And if it's wear and tear, of course, this will progressively get worse as I get older. So you start taking precautions, you exercise, you do stretches, you strengthen the muscles around the joint, so the impact is not so much on the joint itself. And you try to, fashion your lifestyle to suit that. If it is the inflammatory type, then of course there is lots of medication in the market, and the condition usually goes up and down.
All right, great. I think we're just out of time. It's 9 o'clock now, Doc. Tonight's conversation was amazing. Thank you, viewers. We have a caller? Yeah, we'll take that call. We'll take that call,
Hello?
It was hospital, Dr. Shower.
Oh, yeah. At the moment, I'm at Woodlands Hospital 3 days a week, Monday, Wednesday, and Friday.
But you wouldn't be there.
But I'm traveling next week, so I wouldn't be there. My last day is Wednesday coming. Tomorrow, tomorrow's the last day. I'll be away for a couple of weeks. Well, no, but
maybe a month. Yeah, a month.
Maybe a month to 6 weeks.
Like a month?
Yeah.
Okay, then. check you back and I'll check in with you.
Yeah. But for the viewers to know, we will still continue the show.
Yeah, I'm gonna tell them about it now.
Yeah. Okay.
All right, thanks for coming.
Thank
through.
you. Yep.
I
Take
will
care.
keep you updated too.
Cheers. Right.
Yeah. All right. So let me just state this: that Dr. SAWH will be heading out to his second home in England for a couple of weeks, and we were still going to continue the show. We're going to do it in a different format. Dr. SAWH will be on Zoom. I'll be in studio. We are not going to be taking calls, but what we're going to do, we're going to discuss the topics, and you can send your questions via the messages through the chat. You can send it there just like you've been doing all the time. And Doc is going to be, we're still going to be doing the show, and when he gets back, we go back in studio again to taking calls. So the show won't be off. We're going to make sure that it happens. We know that it's important to everyone. So Doc, tonight's conversation was really amazing. I really I know that our viewers loved everything that we do here because I can read from the comments. So again, thanks. Safe travels.
Thank you
Can't wait to see you back. Bring back back in we say bring back ice apple. So I'm looking forward for my ice apple. Viewers, thank you so much for joining us. We're going to be here again next week. Although the format is going to change a little bit. Take care and remember to drive safely. Stay safe. Doc, you want to say anything to them?
Yeah.
You can probably say Merry Christmas now. No. You'll be here next week. Yeah.
Yeah, lovely. Thanks for watching, and yeah. Thank you. Good night.
All right. Good. Thanks. Bye.